It's really important to maintain your health. That's the biggest thing. Just make sure you're focusing, concentrating, and remembering what you're doing. Because if you're not doing that every day, your brain's going to turn to mush.
You're listening to the Integrative Medica podcast with Dr. Jake, a licensed naturopathic doctor who will show you how to tap into your body's natural ability to heal your health issue and improve your symptoms quickly without harmful drugs or devastating surgeries. So pour some tea, get comfortable where you are, and enjoy this healing episode.
Hello, everyone out there listening today. So good to have you with us. I'm Owen, and I'm here with Dr. Jake. And today we're going to be talking about brain health.
Yeah, this is a very important topic because our brains is what makes us do everything in our body, right? So we're going to be talking about what keeps us good memory, what makes us focus well, helps us concentrate, and achieve the things we want in our lives.
So let's dig right in and let's talk a little bit about brain health. You know, is a healthy brain, are we talking about tissue health, or are we talking about cognition skills and that sort of thing?
I think all of the above, but I'm going to probably want to focus a little bit more on the tissue itself. How do we keep the tissue healthy so we can keep our brain functioning, meaning we're able to have good memory, we're able to focus, we're able to concentrate, we're able to do all the things we want that our brain does by keeping it healthy.
Yeah, so that's interesting because I have sort of disconnected the two in my mind. I think of memory as like a skill, but bad memory is like a bad skill as opposed to actually unhealthy tissue. And what you're saying is that when you've got a poor brain health, poor brain skill, there's actually tissue that could be repaired. Is that what I'm hearing you say?
Yeah, so you could have bad memory because you are watching TV all the time and you're not doing anything to work on your memory. Or in many instances, it's because you have a lot of inflammation in there from eating poor quality fats or eating a ton of sugar or having decreased blood flow, meaning decreased oxygen to your brain. And that's why your memory is really bad.
So you're telling me that sugar actually will impact brain health?
Oh yeah, for sure.
So let's talk about that. This is going to be a good episode because you're pretty excited before we got on. You were kind of talking about this is one of your favorite topics, and I don't know much about it. I'm not a smart man, and so
you are, Owen.
I'm gonna learn a ton today. Let's sort of start with some high level stuff. Like, what are the biggest enemies of brain health?
Eating a ton of refined sugar. Having a really high blood sugar, for example. Let's say someone with diabetes, man, they're really at risk of having a really bad deteriorating brain. Let's talk about poor fatty acids. Let's say you eat a lot of crappy fat, you eat a ton of sugar, you form plaques in your arteries, like your carotid arteries. You're going to have decreased blood flow getting into your brain. And guess what? That means that you're not getting good oxygen. Brain starts to degenerate, and then you're not able to focus, concentrate, and remember things very well. So those are dietary things. We also want to get good nutritious nutrients into our body. So if we're eating Big Macs all day and not getting much nutrition, our brains aren't going to have all the magnesium and B vitamins and good fatty acids in there to be able to function very well. So that's on the dietary piece. Well, we want to focus on increasing oxygen delivery. So exercising, aerobic exercise and anaerobic. So biking or running, that's aerobic, or lifting muscles and getting bigger muscles, that's anaerobic. Both are very important and increasing blood flow and circulation to our brain. This is outside of like the tissue itself, but like we talked about, is you need to not retire, so to speak. Now you could retire from your job, but you don't stop doing things and stop learning and expanding your mind, because if you do that, your brain's going to degenerate because you're not using it.
Now, you just mentioned mind, and we've talked about mind, body, and spirit. What's the difference between the mind and the brain?
We could think of more the mind is kind of what we think about, what we concentrate about, and the brain is the structure itself. So we could do things to damage the brain, but not necessarily damage our mind, even though it does decrease our ability to concentrate and focus. I guess those are the differences there I would put. It's just terminology, really.
That's good. And that's where I was kind of trying to go, because you talked about retirement, and this was an interesting topic in terms of retirement being an enemy of brain health because you're not expanding your mind and learning new things. So what role does learning play and mind use, right? Maybe not learning per se, but puzzles or
Mhm.
things of that nature. What role does that play in good brain health?
When you're doing a puzzle, you're concentrating, you're thinking, you're trying to put that picture into place. So you need to use your brain. If you don't use it, you lose it. And that's how it is for the brain too. A lot of elderly people, they stop using their brain. And that's one big reason why they start not being able to think as clearly and not have as good memory. That's a piece of it. There's definitely the structural components that are dealing with that too. The big thing is maybe a lot of old people are watching this right now that are 60 and older, but a lot of you guys are sitting there watching TV all day because you aren't working anymore. And we need to not do that. We need to read books. We need to still continue to learn. We need to do puzzles. We might just do mind games, whatever, to keep your mind working on all cylinders.
Yeah, active and sharp. What role do toxins play, whether they're internal or external toxins on brain health?
Yeah, toxins are a huge piece too. So glyphosate, like in Roundup, in our wheat and things like that, that's very toxic to our brain. Other herbicides and pesticides are really toxic to our brain. Chlorine is toxic to our brain.
Really,
Fluoride
like
can be
swimming
toxic to our
pool?
brain.
Like
What's that?
swimming pool.
Yeah, but we have it in our water, right? If you don't filter your water, you get chlorine every day you drink water. So we have a lot of chlorine in there. That can be toxic to the brain. And swimming all the time in chlorine, yeah, that can be toxic. Yeah.
Wow.
Heavy metals, lead, mercury, those could be huge components of deteriorating the brain, bigger than chlorine.
Where are those ingested or consumed?
Mercury, a lot of times we're getting that. We could get mercury from fish and other things like that. We could get it there, but we also could get it from our dental amalgams. So that silver stuff you have in your mouth to repair a cavity, that's hanging out in your mouth and always getting into your bloodstream. That can be a big issue.
Are there brain diseases that can be traced to cavity fillings?
Oh, yeah. Alzheimer's disease, Parkinson's disease, multiple sclerosis can all be related to mercury poisoning or lead poisoning or arsenic or multiple others.
Wow.
But to teeth amalgams, it's the mercury. And it's a big problem.
Wow. Okay, so we've got some environmental toxins that we need to sort of like steer clear from. What about hormones? What role do hormones play in brain health?
Yeah, hormones are a big piece also. So for men, we want to keep our testosterone at a good level, or DHA level at a good level, and our estrogens low. For women, we want to keep our estrogen, progesterone, DHA, and testosterone in check. Our hormones are little communicators, and they communicate with the brain. So if these are out of whack, it's going to mess with how our brain functions. It's going to lead to more inflammation in our brain, which is then going to damage the brain and make it not function as well.
I want to talk about the signs that your brain is unhealthy, and it's a really fascinating topic for me because I know so little about it. But like, let's talk about what are the signs that your brain is unhealthy. And I do want to ask: does your brain bruise? Does it sag like your eyes do? Like, can the doctor tell? Maybe you're like just not as sharp as you used to be because you're not reading puzzles. But does that actually show up physically on the brain? What are some signs that your brain is unhealthy?
You could have signs based on like a MRI or on an EEG. Those are certain signs.
Mm-hmm.
Or you could just have mental signs that you're not able to remember things as well. You're not able to focus and concentrate as well. When you read, you're not able to understand what you're reading, or you're not able to understand or retain the information. That's the beginning signs that your brain's starting to degenerate. You also could not have as much dexterity. You're not able to have as good a balance. You start to lose some sensation in your fingers and hands. All these things could be there. You can start to get tremors. These are all signs that your brain is unhealthy.
It's interesting with the off balance because it can be so slight. I do a treatment twice a week of poly-MVA. And I think it gives me like these little touches, very momentary of neuropathy, right? But I noticed that my foot is just a beat slower than it should be. Now, I know I'm doing poly-MVA, so I know that this is a side effect. I know that this will pass. But for that person that's noticing just a little bit of slowness or a little bit of hesitation, when is it time to be suspicious? When is it time to say, hang on, maybe I'm having some brain health issues? And when is it just like general fatigue, right? Like, no worries, I'm just tired right now.
Let's say you start noticing this little bit of a tremor in your hand, you like pick up the water and you kind of shake a little bit.
Yeah.
Your brain's not too hot when that's happening. there's some degeneration happening. You start noticing you're not able to remember things as well. I mean, some people say, oh, that's just because I'm old. I'm not remembering things. Guess what? I know 80-year-olds that are just as sharp as I am and thinking just as well as I am. That's not an excuse in my mind. This because your brain is unhealthy. There's something happening to decrease blood flow, circulation, hormones, food, etc. All these potential causes that could be leading to your brain not working.
Okay. So walk us that you said degeneration. Maybe you could walk us down that pathway, like the stages of brain degeneration. Is there such a thing where it's like first this happens and this happens?
There's not specific stages like in medicine of like, okay, you're at stage 4 if it's this bad, or you're stage 1. We don't really have that in brain health per se.
You talked about like Alzheimer's and these different things.
Yeah.
So maybe just kind of walk us through, like, your brain is starting to become unhealthy. Walk us from that point down to you have Alzheimer's or something.
So let's talk about memory. So you could start with the beginning of it. It could just be called dementia, meaning you're just starting to not remember things as well. It's not like you're forgetting your kids' names. It's not like you're forgetting places you have been, etc. Like it happens in Alzheimer's. It's just that you're forgetting things in the middle of your sentences. You're not able to remember things like you used to when you're reading. So that's the beginning stage. And when you're starting to notice that type of stuff, you need to look into improving your health.
Yeah. What are some things that we can do? That's what we want to talk about. But first, as a naturopathic medical doctor, you've helped a lot of patients. Is the goal to stop the corrosion of the brain, or is the goal to build back the brain? And maybe you could cite like an example of a client or a patient you've worked with in the past.
First off, I want to stop the degenerative process and find out exactly what is causing the issue. Like if they're eating a really poor diet and we need to improve the fatty acids getting in there and decrease the sugar, we need to work on that. And we need to work on increasing blood flow, circulation, etc. So those are some pieces that we definitely need to dive into. So I had a patient come in that had some deterioration of his memory, his being able to retain information very well. He was also starting to experience some shakiness of his hands, and he was also starting to shuffle his feet. So he was getting a little bit of Parkinson-like symptoms, and he also was going down the route of dementia. So what we did is we dived into looking at what could potentially be causing this issue. We did a toxic panel on him that we looked at several different toxins. We looked at heavy metals to see if that was a piece of what was going on. We did some hormone panels and we did some nutrient panels to see what he could be deficient in on his hormones and his nutrients. So what we found out on his blood work is that he had high mercury and high lead.
Wow.
We also noticed that he had all kinds of toxic exposure. He did work in a solvent industry, working with a lot of gasoline, things like that. We need to work on detoxification there. We also noticed that his testosterone was low, so we needed to work on increasing his testosterone. So we formulated a plan of doing some chelation therapy on him. We did some therapy to increase his oxygen levels, like hyperbaric oxygen therapy. We recommended he do some sauna therapy to get those toxins out of his body. Then we gave some nutrients that I really like for brain health: glutathione, carnitine, alpha lipoic acid, to help heal and regenerate the mitochondria inside the nervous system. And he's starting to gradually improve day by day.
That's wonderful. So let's kind of dig into some of those things so that our listeners can start to explore and find the therapies that might be good for them or for the people they're caring for. But before we do that, we have to remind you that this is just a podcast and it does not replace, personalized medical attention.
That's right, Owen. That's why if you're dealing with any brain issues, visit integrativemedica.com, find the phone number there, and find an integrative doctor that you could talk to.
Okay, so let's kind of break down these different therapies. Though I think the one I'm most interested in is in the detoxification. Like, what does that mean? Getting heavy metals out, a sauna treatment. What is detoxification and why is that great for brain health?
So detoxification would depend on what we're going to do. So if you have like a lot of solvents or you have a lot of pesticides or herbicides inside you, the best thing we can do to get it out is doing sauna therapy, which is like going in an infrared sauna or a dry sauna and sweating for 15 to 20 minutes and getting those toxins out. We do that about 3 or 4 times a week to be able to do that. Now, if you have heavy metals, some will come out when you sweat, but it's going to be harder to get out because they're hanging out in your tissues. They're in their bones, they're in their muscles, they're in your nervous system. So we usually need to do a chelator. Like an oral chelation therapy is like DMSA. We could do some more natural ones like glutathione. Oregano is a decent one. NAC, alpha lipoic acid. These are some basic things, but DMSA is going to be more powerful. Usually what I like to do to really get it out quick is do IV chelation with DTA or DMPS, etc., to be able to get those heavy metals out, because I don't want them to continue to be there and continue to cause trauma to the brain.
Would you recommend that same thing for somebody post chemo? Like they're done with chemo now and now we want to get those heavy metals out? Okay, that's really interesting. You know, on the sauna therapy, you said sweat it out for 15 minutes. Is that 15 minutes in the sauna, or you got to stay in there till you start sweating and then wait 15 minutes?
So it depends on your cardiovascular health and et cetera, right? What you can do and can't do. But if you don't have any cardiovascular issues, I would stay in there till you start to get a sweat on and then wait 15 minutes.
All right.
Usually what I recommend is exercising, getting your blood flow going, and then get into there because you're going to sweat much faster.
And are these, we bought a Maxis sauna infrared and I love it. It came on Amazon and it was like 4 pieces that just was you're able to put it up because detoxifying is huge for us. Do you recommend an infrared sauna like that? Or is it like, as a naturopathic doctor, like you have access to better saunas?
No, the infrared sauna, I do recommend you get a good quality infrared sauna that is going to increase your heat really well. I know I've talked to some of my patients that are in the sauna for 60 minutes and they're saying they're just start to sweat like the last 10 minutes. Maybe they have difficulty sweating, but if you got in one that I have, there is no way. I mean, I've been in there 25 minutes and I'm like huffing and puffing because my heart rate is like starting to really get going because I'm so hot and I've been sweating for like 15 minutes. That's what I really like it to be like, is because I'm dumping bullets at that point. So you can just get a portable one. You want to make sure that you're getting a good sweat and it's having good heat.
I warm mine up. So I wake up almost every morning. You know, there's those lazy Fridays that I'm victim of too, but I'm guilty of too. But I typically wake up in the morning and I walk downstairs and I turn the sauna on and I let it warm up for 20 minutes. And then I kind of do my morning routine and I step into a warm sauna, which helps to get me kind of dripping a little bit faster. But let's keep moving on about brain health. You also mentioned foods and healthy fats is kind of what I heard you saying. Like the avocados comes to mind, but expand on that. Like what is the role of healthy fats and diet in general when it comes to brain health?
Yeah, healthy fats are huge, and the type of fat you get is huge too. Remember back in the day when fat used to be really bad guy and sugar was good stuff? I remember that. And that's the worst thing we could do for our brain, is just shovel in tons of sugar, eat very little fat. Or let's talk about statins, for example, the medication statins and decreasing your cholesterol levels. Guess what? Our brain is made up of a ton of cholesterol. So if you're plummeting your cholesterol levels, your brain is going to be working as well. But let's go into fatty acids like omega-3 fatty acids. Really what I recommend is everyone needs to do that if you want a healthy brain, or really if you want a healthy cardiovascular system or you want to decrease inflammation. You need to get good omega-3 fatty acids. You need to be eating good quality fats like olive oil, avocado oil. I'm a fan of coconut oil also too.
Yeah.
Now it is mostly saturated fat, but the difference is it's a short chain fatty acid compared to a long chain fatty acid that's an animal product. And if you get good quality animal products like grass-fed beef, the fatty acid structure is completely different than if it's a corn-fed beef. The fatty acids are going to be more like olive oil from a grass-fed beef, and it's more like just saturated inflammatory fat in the corn-based beef. So those are important things. You want good quality, healthy fats getting into your brain. You don't want tons of vegetable oil. You don't want a ton of soy oil or things like that either.
I recently bought on Amazon these coconut oil packets, and they're like these self-serve, almost like a mayonnaise packet, like a ranch packet that you'd get from a restaurant, but it's just straight coconut oil. And these are really great to have on the go as little like in betweens. You know, I'm waiting in the doctor's office, I'm hungry, I'll have a thing of fat. And these are for the keto diet because I'm a keto dieter. Are you telling me that we need to be on keto for brain health, or just like a spoonful of fat will do a spoonful of good for brain health?
Yeah, you don't have to be on a ketogenic diet to have a really healthy brain. You just want to get good quality fatty acids into your dietary routine, and you don't want to be eating tons of carbs all the time. You want to reduce your carbohydrate intake and increase your fat intake, and you don't have to necessarily be in ketosis.
Okay. When you eat sugar or carbs, the carbohydrates in the sugar, is it like bruising, like hurting your brain, or is it just not feeding your brain good stuff? You know what I
It's
mean?
not necessarily bruising or hurting it, but it is causing inflammation in your brain
Got
and
it.
causing dysregulations of how it functions.
Okay.
And over time, it will damage the brain.
So you're telling me that most Americans are walking around with brain inflammation because of all the carbohydrates and sugar they're consuming?
All the time.
Wow.
And that's why you say it's very normal for people to feel brain fog, right? A lot of people say they have brain fog, or a lot of people have fatigue, or they're like, I can't really concentrate and focus very well. Quite normal, right? But it's not ideal. It's not really how it should be. And if people started eating better, they'll notice that their brains are going to be firing on all cylinders.
Yeah. The other day, we were sitting in a movie theater that was empty. And we sat sort of like in the middle. And this other guy walks in and he comes and he sits right in front of us. And I go, that guy must have a brain health problem. I can't believe he starts to sit right in front of me. But that's really fascinating. So like just a spoonful of fat a day. Dr. Gundry talks about a shot of olive oil every day. I've been taking a spoonful of olive oil every night. Is that, I mean, I've always thought that's kind of an extreme health nut thing. Is that what you're suggesting for like the average listener?
I mean, you don't have to do that. Is that a good idea? Yeah, it's probably a good idea, but you don't have to just do olive oil. You don't have to eat olive oil every day. You just get other good quality fats, avocado oil, olive oil, coconut oil, get a lot of good fatty acids from nuts and seeds. It's not just from like oils. You get it from nuts and seeds too. Nut butters, stuff like that.
Macadamia nuts, that sort of thing.
Yeah. You want really awesome fats. The awesome fats are avocado, olive oil, coconut oil, flaxseed oil. These are all really good. Chia seeds are really great, and hemp seeds. These are oils that are really great for you. But I want to get tons of good fatty acids from nuts too. Yeah. But I'm not saying go crazy on the peanuts, but eating good quality nuts and seeds is very important for brain health.
Okay. And farmers markets, great place to go. Health food stores, great place to go and to buy that stuff. What about oxygen? I love exercise. I love being an active person. How do we get more oxygen into our brains?
Exercising, doing an aerobic activity, going for a run, going for a walk that gets your heart rate up, going for a bike ride, something like that will get your heart rate up and increase that blood flow getting into your brain and that oxygen delivery. And you need to do this consistently. It's not like, oh, I go for a run every month. Yeah, that's not going to keep your brain healthy. It needs to be a consistent thing. You do some type of exercise, maybe 3-4 times a week to keep that blood flow going into the brain and keeping your brain firing all cylinders. I also want you to, anaerobic means build your muscle mass, because that's going to improve the circulation throughout your body and the blood flow going to your brain also.
Blood flow versus like an oxygen mask or hyperbaric oxygen chamber therapy. Talk about that a little bit, about hyperbaric and
so I love hyperbaric oxygen therapy. Exercise is great, but hyperbaric oxygen is going to get the oxygen to the brain so much more than anything else you could do, especially if you've already caused some inflammation in your brain. So this is what can happen. So let's say you already have inflammation in your brain and you're exercising. You're not going to get that red blood cell getting into your brain very well, because your capillaries, which deliver that red blood cell, isn't able to get in there because the capillary narrows. So the circumference is decreased. So the oxygen's not, the red blood cell's not able to get in there and deliver that oxygen. So what we want to do is hyperbaric oxygen doesn't depend upon a red blood cell anymore. It supersaturates the red blood cell, but then it is able to infuse right into the fluid base of your blood. And that fluid is able to go right into that narrow capillary, get into the brain, start getting the oxygen in there. And over time, that inflammation in the brain decreases. And then when you exercise, you're able to get that oxygen really well into your brain.
Is a hyperbaric chamber something that a non-medically needed thing? Like, you don't have to get prescribed a hyperbaric. Like, could somebody say, I want better brain health, so I'm going to come to Dr. Jake's office and do the hyperbaric once or twice a week? And what would you recommend for that? Like, how often do they, would be ideal for that?
In the very beginning stages, let's say you have some dementia, or maybe you're getting into the range of Alzheimer's, we need to become really aggressive. Or Parkinson's disease, we do about 40 to 50 treatments of that 3 or 4 times a week to get things going. And then we do a maintenance of doing maybe 1 a week or every 2 weeks to keep well. Maybe you're in the realm of you just want to be healthy. You could come in and get hyperbaric oxygen, maybe 10 treatments twice a week for a while, and then you get a treatment every month. or every 2 months. And that's able to keep good oxygen flow getting into your brain and able to maintain a good, healthy brain.
Yeah. You mentioned someone who's like knocking on Alzheimer's door. What about the person who is just like in this place? Maybe she's about to turn 40 and she's like, I just want a sharp brain going into the second half of life, like brain maintenance, I think is what I'm talking about. Is there brain maintenance programs or protocols?
Yeah, I do that all the time for my patients. So it's about diet, it's getting the right nutrients into your brain, it's about exercising, and also hyperbarics is a big piece, and also getting your hormones regulated, maybe getting bioidentical hormones to get your estrogen, progesterone, DHEA, and testosterone up. And that can get your brain firing in all cylinders and also decrease your brain from degenerating over time. The biggest thing we want to do is prevent, right? We want to keep the brain from getting bad, because when it gets bad, there's a lot more work that we have to do. But preventing it is doing those things that I just discussed, is able to keep your brain working really well.
And it feels like a lot of these things we could do on our own, right? Like exercising.
Yeah, a lot of them.
For one, or diets. You mentioned we really went into healthy fats. What other foods could we be loading up on that are positive for the brain?
Berries are really good for the brain. They have bioflavonoids in there, which are antioxidants. So they're really great for the brain. So getting a lot of foods that have high antioxidants. Yellow onions are high in quercetin, which is a great antioxidant. Spinach and kale and broccoli and all these type of things. Those are really great for your liver and also for your brain. Good quality fish is really awesome for your brain because they're going to be high in the omega-3 fatty acids. Just make sure you get it from the ocean and not from farmed, except if it's farmed with eating algae, which they will say, because a farmed fish isn't going to have high omega-3 fatty acids. This is going to be high in saturated fat. It's like eating a cow, so to speak, that's been eating lots of corn. So it's not necessarily healthy at that point. But if you get it from the ocean, they've been eating the foods off the ocean, they are going to have high omega-3 fatty acids. But then you want to watch to see how much mercury is in the fish too. So usually a North Alaskan type of fish is the cleanest fish we got.
Yeah, we keep an eye on all the fish that is sort of coming in. But that sounds delightful, really, like spinach with some greens in it, maybe some berries, and then a bunch of olive oil on top. Like that is just like a
lot of olive oil on your berries. Yeah, that sounds fantastic.
Well, like for me, I'm a keto guy, and so I put oil on just about everything right now, and it keeps things. I like to hear that I'm doubling up, right? Because I'm eating all of these salads to decrease toxins and get my calories up, but also because I believe in dousing vegetables in oil.
Yeah, you need to do that. That's great. Good quality oils. I just have to reiterate that you need to get the good fats on your veggies. Don't just start eating a lot of crappy
no fats. Soybean oil, no. Canola.
Vegetable oil, safflower oil. Don't load up on those.
Yeah, it's going to be the extra virgin olive oil, avocado oil. That's really good. What about brain activities like, I know it's crazy, watching Jeopardy or some other type of activity, and I know that that's media, but that you're using the brain, right? And not just sitting around being entertained. Maybe even crossword puzzles. Like, what are some of the brain activities that we could do that'll keep us sharp?
So a lot of the things you just said are very good. I mean, if you're a Jeopardy person, sure. If you're actually watching that and you're thinking about what is going on there and you're just not like vegetating and not really thinking about it, there's a different story. So you need to make sure you're thinking, memorizing, and understanding.
Wow, memorizing.
Yeah, memorizing is huge. You need to start memorizing certain things. Maybe you could just memorize some words every day, vocabulary, or maybe you just memorize the book you read. I mean, you don't have to dive in and read a medical journal or whatever. You can read good books, but you just want to retain that information and remember that information is really important to maintain your health. That's the biggest thing. I don't care what you do. Just make sure you're focusing, concentrating, and remembering what you're doing. Because if you're not doing that every day, your brain's going to turn to mush.
Yeah, I really like that. I really like the idea of, and this is old school because we're a kind of a techie family, like everything's on devices these days, but we do have these tearaway calendars, and it's like word of the day or verse of the day or quote of the day. I've got these all over the house and the office and stuff. And so there's always like some new thing kind of like I never thought to memorize these things. In fact, maybe I'll get a joke of the day and start memorizing it. And then I'll be funnier when I come to your office for treatment.
Yeah, we need that. We need more jokes in the office.
There's dull roar of laughter. It's like Owen must be here entertaining
Exactly.
the folks, in the back room. But I'll tell you, my brain gets the best workout when I'm reading the bills that you send me. But
Maybe that's the stress response. Maybe that's not good for you.
well, yeah, it's true. Actually, I thought it was all part of your plan to make your healthier. This guy's genius. He's genius. But that's all the time we have for today. Dr. Jake, thanks for joining us and talking about brain health.